HIV is a stigmatized condition mainly due to the way it has been reported in the media over the last 30 years. The way HIV is transmitted and the link to sex has added to that stigma. Despite efforts to address the stigma, it is still an issue, and recent developments, particularly around the criminalizing of HIV transmission, have added to that. The potential for stigma means that people are reluctant to share their HIV status, which of course then makes it a hidden problem. The stereotypes and presumptions around who is likely to have HIV and who is not is problematic. For example, if someone is known to be gay and they are ill, losing weight, it is likely that people will presume they have HIV, where a white woman with the same symptoms may well remain undiagnosed for a very long time, as her doctor may presume she is not at risk. The stigma and discrimination around HIV impacts family and friends. For example, children of HIV-positive parents quite often are bullied, and the parents of their friends may not allow them to visit. The confidentiality of the HIV diagnosis is usually maintained within the family. The many HIV-related and AIDS-defining illnesses mean that people are likely to be experiencing multiple illnesses along with many side effects of the drugs. Although this has reduced with successful drug treatment, there is still the issue of uncertainty around if you will get ill, and if you do, what will that illness be? Living with a partner who has a life-limiting, life-threatening illness is not easy, but when HIV is the issue, you also have to accept that, as long as you maintain sexual relationships, there is risk to you. Misunderstanding regarding HIV sometimes makes others reluctant to take positive individuals as partners in the first place. This is true even within communities disproportionately affected by HIV. Although HIV can and does infect anyone, there are some communities in the UK where HIV is more prevalent. These include gay men and some African communities. People from these communities often already feel marginalized, and then they have HIV to contend with too.